it is time for our second speaker in this session, and our next pair of speakers are my colleagues from the Centre for Sustainable Healthcare. They work in the Green Spaces for Health team. Sarah Jordan is the director of the Green Spaces for Health program, and Dan is a project manager within the program. And they are going to share with us probably our most underused resource to maintain health and well-being, nature. Over to you both.
Brilliant, thank you. I'm just going to share my screen. There we go. Well, it's really lovely to be here today, and it's been fantastic to hear about all of the amazing projects so far. So as Ioma said, my name's Sarah and I'm joined by my colleague Dan, and we are part of the Green Space for Health programme at CSH. And we're going to tell you a bit more about the importance of nature as a quality improvement and in prevention, and as an integral part of a sustainable healthcare system. And we're going to share about a project that we worked on recently. So to start off, just to share a bit about what we do within our team. So you might have heard of the NHS Forest. It's one of our kind of flagship projects within the Green Space for Health team. And we've planted over 160,000 trees on or near healthcare sites since 2009. We also have a network of over 400 NHS Forest sites, which are essentially healthcare sites who have signed up with a commitment to protecting and improving biodiversity on their sites. We also have 9 nature recovery rangers who are based at 10 NHS trusts across England. Their very special role is to protect and improve the green space within their trust, so on the sites within their trust, and importantly to connect people with those green spaces for their health and well-being, whether that's patient groups, staff groups, or maybe members of the wider community as well. So our overall goals are to protect and improve green space and biodiversity, and as I say, to connect people with that for their health and well-being. And when you think of a hospital or a healthcare space, what comes to mind might be something quite kind of sterile, clinical, blank canvas, sort of squeaky clean floors and that kind of thing. But actually, there is space for nature to bloom within healthcare settings. And these are all photos taken from NHS Forest sites that we've worked with and are working with. I suppose the question is, well, why is it important? Is it just a nice to have? So I wanted to share with you some key studies that demonstrate the importance of nature within healthcare. So this first one is a study by Rosalind and colleagues, which showed that when children are exposed to more biodiverse environments, it actually boosts their immune systems in later life. So it creates a more diverse microbiome on their skin, and their blood samples actually showed higher markers of immunological markers, which is really fascinating. And another study pointing again to kind of prevention was this one by Rankin, who looked at the level of green space and tree coverage in particular areas and found that when there was more green space available, there was a lower need for urgent and non-urgent medical care, again suggesting that actually exposure to green space and access to green space meant that people had less need for the healthcare system. Nature's also been shown to reduce health inequalities. So research has shown that actually the amazing benefits that nature offers to our health has an even greater effect for people who are living in social deprivation. So it has the potential to actually help tackle health inequalities as well. You might be aware as well of the sort of original study by Ulrich in 1984, which showed that if people simply had a view of a tree from their hospital window, it sped up their recovery time and reduced their need for painkillers when they were recovering from surgery. And in a more recent study that was published just at the end of last year, it found a really similar effect, and actually found that when people had more views of nature from their hospital room, it shortened the length of stay even more, and got them home quicker. And also, nature within healthcare settings is amazing for creating a healthier workforce as well. It has great benefits for staff well-being and keeping our staff healthy and well at work. Some research that we carried out in 2020 found that when NHS staff spent more time outdoors at work, they had higher levels of well-being. So I'm not going to go through each and every one of these, but it's just a snapshot of some of the research to just demonstrate how much research is going on into the benefits of nature for health and well-being, looking at cardiovascular health, cancer-related outcomes, all-cause mortality, immune function, mental health conditions, and cognition. The list goes on and on. There's just so much research happening, which is fantastic. Yeah, I think all of it goes to show that, as I mentioned before, it's not just a nice to have, having nature within healthcare settings. It has really tangible and important benefits to both staff and patients, and is a really integral part of a sustainable healthcare system. So I'm going to hand over to Dan now, who's going to share about a project that we worked on, which is particularly looking at that kind of prevention agenda and health within the community.
Thanks, Sarah. So yes, a key project delivered through our Green Space for Health programme and that aligns with prevention is our Green Health Routes, where we have delivered many over about 9 years and covering areas of Oxfordshire, Wales, Wiltshire, and more recently the North East. Demonstrating how accessible green space can become part of a more preventative and sustainable healthcare system. So the routes are locally designed walking routes connecting trusted community hubs such as GP surgeries and libraries with accessible green spaces. And each route is supported by simple neighbourhood maps joining the dots to connect these spaces, highlighting accessibility, facilities, confidence levels as well, and local points of interest, helping make local nature feel more approachable and easier to use. So what makes the project particularly relevant to prevention is that it helps make nature and physical activity a more realistic part of everyday life. So rather than expecting people to travel to a destination site, the routes begin from familiar places already embedded within communities, helping to reduce barriers and build confidence to spend time outdoors. So the routes are co-designed with local communities to ensure it's felt that it's welcoming and accessible to different needs and confidence levels, as I mentioned earlier. And alongside the routes, we use printed maps, develop digital resources, develop walking groups, and deliver nature-based activities to encourage regular use and connection with local green spaces. And from a healthcare perspective, the routes support green social prescribing initiatives and wider preventative approaches. So we work closely with healthcare professionals, particularly GPs and link workers, to encourage them to recommend the routes as green prescriptions, particularly for people experiencing mild anxiety, low mood, loneliness, inactivity, or early stage long-term health conditions as well. Next slide, please, Sarah. So yeah, what changed for communities? So feedback from the projects we have delivered over the years have shown encouraging qualitative impacts across the communities we've engaged with. So participants consistently describe feeling calmer, less stressed, and more connected to nature after using the routes. Many also reported increased confidence spending time outdoors independently, and particularly when the routes felt easy to follow and reassuring to use. The routes also support physical activity, with some participants progressing from short, supported well-being walks, where CSH have been delivering that, to independently using longer routes and incorporating the walking in more of their daily life. Socially, the project helps contribute to reducing isolation and create opportunities for connection through shared walks, local activities and community engagement. And participants consistently reported the value of informal, welcoming, and non-clinical nature, or the non-clinical nature of these experiences. And at a wider community level, the project model is strengthened through the relationships with key stakeholders. So that includes the healthcare services, councils, community organisations, and local residents as well, helping to position green space as a part of a more interconnected community approach to supporting people's health and well-being. Next slide, please. Also, importantly, the project has helped start to shift perceptions of local green space from simply recreational places to more valued community assets that can actively support people's health and well-being. The routes also help create lasting local change through resources such as the accessible maps, guides, virtual walks, and developing sustainable walking groups that continue beyond the funded projects where we've been able to kickstart these routes. The routes become embedded within the local community programs as well, and event calendars that local community groups have been actively continuing to use them, and the healthcare and local council officers are continuing to promote and signpost to them, which is really positive. And from a sustainable quality improvement perspective, over the years, we've definitely been able to refine the model, and it's very adaptable, and it can be replicated and scaled up using the existing local assets such as the community hubs and the green spaces, and developing partnerships as well. I also just wanted to briefly touch on the case study that you've probably already read already, but it's involving a participant recovering from cancer who initially used the routes for short, manageable walks to rebuild confidence and strength following treatment. But over time, they progressed to longer routes with us and independently, and eventually joined local walking groups, which is fantastic. So yeah, just to sum up, so alongside those sort of physical benefits and others that I've mentioned, it's describing and emphasizing the improvements in social connection, motivation, and highlighting how accessible nature-based opportunities can support prevention, recovery, and long-term health and well-being in a more holistic way. That's everything for me. Thanks, Sarah.
Thanks, Dan. So yeah, we hope you've enjoyed hearing about our Green Health Routes project. And if you're interested to hear more, then please do follow our social media and sign up to our newsletter as well. We've got a SusNet as well as part of the CSH networks, the Green Space for Health network, which we'd love to have you take part in. And yeah, feel free to contact us directly as well if you're interested in any green space projects where you are. Thanks very much.
Thank you, Sarah. Thank you, Dan. It's always great to hear about everything that's going on in the Green Spaces team. It's not a typical SusQI project, but it's still so important to hear about kind of the untapped potential. And I think that study that you showed with the recovery time, just by having a view of nature, is unbelievable. And I think we should be tapping into it a lot more. So thank you so much for giving us your time.